This is the sound of a healthy heart. But some people are born with a condition they might not know about until it's too late. The good news is there's a heart clinic working to prevent a certain kind of sudden cardiac death. The work is done by solving genetic riddles, which are also profound family stories.
I received a call from a mother who had just lost her second young adult child to a sudden death. And she was desperate to find out what she could do to protect her lone surviving child.
I'm Sarah McConnell, and this is With Good Reason. Today we look at the heart. It happens very rarely, but when a young athlete suffers sudden death from cardiac arrest, it's tragic and confusing. Back in 1990, in the middle of a basketball game, rising star Hank Gathers fell to the ground as his heart gave out.
A tragic end to a West Coast Conference basketball game tonight in Los Angeles. Hank Gathers crumbled to the floor. He died later at a Los Angeles hospital. Gathers was just 23 years old.
It's cases like Hank's that prompted the development of the University of Virginia Cardiovascular Genetics Program to improve the treatment of hereditary heart conditions. My two guests are co-directors of the Cardiovascular Genetics Program. Matthew Thomas is a genetic counselor, and Matthew Wolf is a cardiologist and geneticist. Matthew Thomas, let me start with you. What happened to Hank Gathers?
So 25 years ago, Hank Gathers, a college basketball player at Loyola Marymount, was playing in a basketball game leading up to the NCAA tournament. In the midst of the play, he went up for a dunk, and then shortly thereafter collapsed on the floor and unfortunately didn't survive.
Matt Wolf, what condition did he have, do we now know, that we might have been able to screen for?
So he had essentially a very thick heart muscle. Nowadays, we understand more about the genes that can cause this particular heart condition and are able to screen for those.
Could we have screened for it 25 years ago?
That's a good question. I think the ability to screen genetically 25 years ago was probably really in its infancy. We could tell through other types of testing that could show that the heart's abnormally thick, but not necessarily a genetic cause for that thickness.
You know, one of the challenging things about these conditions is not everybody knows when somebody has a thickened heart. I had a patient give a presentation at a conference I was at, and they called inherited heart conditions like this being a smooth criminal. And I thought, well, what does that have to do with anything? That's a Michael Jackson song. And he said, well, a smooth criminal is somebody who commits a crime and somebody else is found to be to blame. And so for a lot of these conditions, people will say, oh, my grandmother or my parent died of a heart attack at a really young age, when in fact it was potentially something else entirely.
What do you mean? What could it have been?
So conditions like hypertrophic cardiomyopathy, other inherited heart conditions that cause the electrical system to malfunction in the heart rather than, traditional heart attack.
It's so interesting that you're telling me there's a difference between a heart attack and this congenital condition.
Yes, heart attacks are pretty common, and everybody, I think, knows somebody who's had a heart attack. But those usually occur because of heart blockages. And we're talking about a condition of the heart muscle itself, in which the heart muscle is either too thick or too thin.
When I'm counseling patients and they're asking, what is the distinction between a heart attack and a cardiac arrest, or a heart disease versus a cardiomyopathy, one of the main things I try to relay is some of these genetic heart conditions, these inherited heart conditions, you can't exercise to make them better. You can't, not smoke and make them better. It's not an environmental thing. It's a gene that you're born with. There are certain things we can do to protect people that are born with those genes, but we have to know that they have them to know what treatment they need. I would say the most powerful story I've experienced, and it really got me inspired to do cardiovascular genetic counseling, was I received a call from a mother who had just lost her second young adult child, to a sudden death. The medical examiner was able to determine that the cause of it was a heart muscle disease that caused a fatal arrhythmia, but wasn't able to say what that meant definitively for her third child that was still living.
She lost 2 adult children to this.
She did, and she was desperate to find out what she could do to protect her lone surviving child.
Who was how old at the time?
He was in his early 20s. And so what we did is she was remarkable at gathering records, and I got in touch with the medical examiner who was working on her daughter's case. We got a sample sent out to a genetic testing lab that was able to pinpoint the exact gene that was responsible for the disease that caused her death. And when we found that gene, we were able to test her surviving brother and prove that he did not carry that gene, and he is then clear of this risk. It was the most reassurance we could possibly provide a family. And when I contacted her in follow-up recently, she told me that her son had just had a child. So she now has a grandson, her first grandchild. And they're so reassured to know that not only is her son okay, so is her grandson.
Have they tested the grandson?
So they don't need to. The gene doesn't skip generations, fortunately. And so because the father, her son, doesn't carry it, there's no need to test the grandson.
So of the most common heart failure conditions that you can detect through genetic screening, which of those actually have treatable aspects?
Almost all of them have some aspect that's treatable. For example, medications, things called defibrillators that are like pacemakers, and sometimes even procedures to relieve that obstruction that occurs because of the thick heart muscle.
Is another one of the conditions where the heart is actually enlarged and the walls are thin.
Yes, that's right. We call that dilated cardiomyopathy. And again, there are a variety of medications that have been proven to be life-saving and beneficial, beta blockers or ACE inhibitors. We also can provide defibrillators again, or where the disease has progressed, we can also provide either things called left ventricular assist devices, LVADs, that are heart pumps, or even transplants.
So the inherited heart conditions are ones that all lead to sudden death?
They all predispose to some risk of it. And what the value of knowing if you have one is to figure out whether your risk is high or low. So some people can have some of these heart muscle diseases or heart rhythm disorders that are inherited, and their risk may not be very high.
How could you have these inherited disorders and not have high risk?
Well, it turns out that not all conditions are created equal. There's some families that I've followed that they all have the same exact gene, and the way that it affects them is different. Some have much thicker hearts than the other family member that doesn't. So if you know somebody has a thickened heart, competitive sports are not always allowed because you're putting yourself at higher risk for having an event. And so we have to take great care when we make that decision and make those recommendations because we don't want to ruin somebody's life.
Yeah, I agree. It's very complicated. You can have one gene that is associated or can cause a disease, but all the other genes that you inherit can modify that particular condition. And that's why two family members who inherit the same gene may have differing degrees of how thick their heart muscle is or differing degrees of risk of having sudden cardiac death.
Are men and boys more likely to suffer this than women and girls?
So some of the best data we have are in NCAA athletes. It turns out that basketball players are at higher risk, African Americans are at higher risk, and males are at higher risk. Now, we haven't quite pinpointed what is the reason for that individualized higher risk, but we treat men, women, athletes, non-athletes across the board because they all have some risk that we have to sort out what it is for them specifically.
How does the screening process work? Is it saliva or blood? Is it arduous? Is it quick? And is it covered by insurance?
So the genetic testing process practically is quite easy. I mean, you need to provide a sample, a blood sample, a saliva sample. The thing that takes more time is explaining what those results mean for a patient. What does it mean if I have this condition for myself? How do I tell this to my children, my brothers and sisters? Does it change how my cardiologist cares for my heart? In regards to insurance costs for genetic testing, we are in a great era for access to genetic testing. When I started doing genetics 8 years ago, it was a big challenge to get individual tests covered. Nowadays, people recognize the value of genetic testing. And another thing is there's labs that are competing with one another, which has driven costs down quite a bit. And the third thing would be the Supreme Court decision to sort of eliminate patents on genes.
So who should come into you? Should mostly we wait to be referred by cardiologists, or should we flood into the genetic screening labs?
That's a great question. You know, Matt and I talk about this all the time, about the patients that we would like to see. And first I would say I'm happy to see anybody. a definite red flag should be if you have two family members who have a similar disease. There may be an inherited component, and we should definitely see them.
One of the fortunate things that I can tell a patient that is newly diagnosed, not only is there active research, there's actually active clinical trials going on that are trying to use specific medications that are targeting people that have specific genes that are causing their disease. It's not gene editing per se, but it is designed based on the gene that's affected. And there's also drugs that are traditionally used, blood pressure medicine. There's a lot of hope that things are going to improve, in addition to the fact that just good surveillance can protect them as well.
Before I let you go, have you followed the recent edicts on staying away from processed meats and bacon? As people who are, immersed in heart health, is that something you knew already and abide by yourself?
I certainly try my best to avoid those types of foods. And I can tell you that as soon as that came out, the first thing my wife said to me when I got home was, no more bacon ever.
And I swear our wives don't talk. They haven't met before, but I came back from a meeting at Pittsburgh. I had a lot of red meat that meeting, and my wife also had a couple of burgers while I was out of town, and she saw that on Today's Show and said the exact same thing. We're going to have to limit. We're going to meatless Mondays, I think that she said it.
I think we're all heading in that direction. That's too bad. I love bacon.
Me too.
Well, Matt Wolf and Matt Thomas, thank you so much for sharing your insights on With Good Reason.
Oh, thank you. Thank you. It's been a pleasure.
Thank you very much.
Matthew Thomas and Matthew Wolf are co-directors of the Cardiovascular Genetics Program at the University of Virginia Health System.